Good afternoon. Happy Friday. I hope you're getting to enjoy a little bit of the sun today. It's just wonderful. I can't wait to finish up some work and get outside, try to get the kids outside. I just want to mention first that it's Developmental Disabilities Awareness Month, and that's a chance for us to know more about our neighbors and friends across the state who have developmental disabilities or care for someone or have a loved one with developmental disabilities. I'm very proud to serve as a Senate co-chair for the Waiting List Caucus, and what that caucus does is really look at those with developmental disabilities, individuals who have those developmental disabilities across the state, and their caregivers and what services they're receiving. We have a very large backlog of people who need services of all different types. Some need many supports to be independent or to be with their families. Others need less, and we have over 5,500 people waiting for services and around the same amount receiving services. And so that's something we really look at as our systems, how our Department of Human Services helps those folks, serves those caregivers and individuals, and what those people who are waiting for help need as well. Lots of goals around that, so we could talk more about that, but I want to just acknowledge the Awareness Month. You can follow the ARC of Oklahoma if you want more information about activities or ways that they're building awareness. I want to talk about just two things today, if I can stay on track. The big things I want to talk about first, a little bit about COVID, some bad news and good news. I want to address first that I'm on the Legislative Office of Fiscal Transparency's Oversight Committee, and that is a legislative body that's kind of an investigative arm. It's new this year. And we have staff members who spend time delving into topics we're concerned about. And it's a way that the legislature can get more information. And we also share the reports with the public about specific topics. They also come back with policy suggestions. And I'll just say I don't always agree with those, but it's been really helpful to have the additional information, especially quickly. That's the same group that analyzed the way that our state government spent the CARES money, the federal relief package. And so I think it's important to have some of that information in real time. We just got a new report, which is pretty disappointing, about how we handled contact tracing throughout the pandemic, how the State Department of Health budgeted that and staffed that. And you can read the report at the Legislative Office of Fiscal Transparency, but the big takeaway was that we weren't prepared technologically or staffing capacity wise. We didn't really have updated plans. And then we just didn't ramp up fast enough or with enough capabilities to really address the problem. We had too few people working, and case counts were jumping and rising very quickly at the same time we were trying to scale up that contact tracing, and we did not keep up, nor did we have a focused effort in a specific way. So this report was really hard to see, and I'm really concerned that we did not invest enough. We invested a very small percentage of our federal package on these measures. And, to me, any deaths we could have avoided or spread we could have avoided is worth that, making it a priority. I do want to say that I very much support the State Department of Health staff. They've been cut to the bone over the last few years, about the last decade. They've received a lot of cuts, fewer and fewer professionals. And, so they entered the pandemic in a very challenging spot, and people have been working hard all year long. I know that. And I'm very impressed. I want to give a shout out. I see Dr. Stump. Yes, we really did pretty much give up on contact tracing. The commissioner called it decentralizing. Essentially, that means you're on your own. Unfortunately, that meant that school districts, schools, businesses, local communities had to decide if they were going to contact trace and work that out on their own. And, that's a real problem to put all that on local communities. Plus, it doesn't give us any kind of understanding of what's happening across the state. I'm pretty worried. We talked this morning in our COVID briefing with the State Department about, are we ready if there's another surge? Are we better equipped? And it sounds like on the hard side, we are. Like we have, we're in a better shape as far as protective equipment. They're still working on technology. That's not something they can fix overnight. But I'm pretty concerned still about that, about the priorities and goals. And that if we have another surge, which, it's very much anticipated we can, that we have the priorities right about mitigating spread. I do want to mention that our vaccination efforts are going well. I know now that on starting Monday, all 4 levels are available anyone in Oklahoma over the age of 16 is eligible to get a vaccination. So I hope if you haven't yet, you'll take that opportunity to do it now. They're going to start providing doses to local providers. Your family doctor might end up getting it, certainly local clinics. And I think it's really necessary for folks to get it as soon as possible. You can see what a difference it's made to have as many people vaccinated as we have so far. I agree. I heard the budget request this year. I see Dr. Shunt commenting on a flat budget being requested. Last year it was requested flat. This year I don't think we asked for near enough. I think they're very much counting on those federal dollars to fill in those extra needs. But God, we see the challenges our communities are facing, and I think we better tackle them head on instead of this kind of passive approach where we're just kind of managing hospital beds. Vaccinations are going to help, but as we've seen, the uptake is a lot lower. I saw that Oklahoma County is at something like 63% of eligible people have gotten vaccinated, at least their first dose, whereas other counties very much lower percentages, and we have to make sure that's higher if we want to keep people safe. So that's the big things on COVID. The other big remark I want to make is on public education. I saw in the Finance Committee this week a bill that's being pushed forward to change our funding formula, and I just I had to oppose it, and there's a lot of challenges with it. It's being presented as a way to make money follow the student, but what it actually does is creates barriers for schools to be ready and to manage change for the students that they have. So it would change our averages so that the districts will get money based only on last year's students or the beginning of the school year. So just the first 9 weeks of students. And what we've seen is that with transfers and with students starting late, those numbers do fluctuate some. This would change it where right now you're able to look at 2 years of past data. So for instance, if a small district has a small pre-K class, those numbers might go down, but they still have to be equipped because the next year there might be more kids or siblings arriving, and they need to have those teachers and those classrooms available. Now, if it's a long-term trend, if a community is facing a long-term reduction in population, they can prepare for that. This gives them more of a cushion to say, okay, next year we're going to have to look at whether we remove these programs or change our classes or close a building. But with the 1 year turnaround, we're actually asking superintendents to make very quick decisions to cut back. And when we know that that will harm the students that are left in those schools. So I would recommend you watch that bill. It went through Finance Committee. It'll be in appropriations, assuming it gets heard, it'll be in appropriations and then would be on the Senate floor. I'm glad to talk to you more about that. That's House Bill 2078. And then yesterday there was the State Department of Education passed a settlement that we're going to have to learn about the consequences of it, but it would do change the way local funding and some of the other funding avenues go towards charter schools, including virtual charters. And we very much need to look at that and see, number one, is the settlement legal? The superintendent, Hoffmeister, said she doesn't believe it's legal, and the school board's own lawyer said that it's not legal, so it actually bypasses the legislature to make a really big change. And then we also need to look at how that deal got made. We need to know what's fair. Our local communities, buildings, etc. We need to make sure that that is fair. And we still expect our local school districts to have a chair, have a quality seat for that kid. And we want to give them the support they need to make sure that happens. Our public schools have been doing amazing things throughout the pandemic. I know I'm a parent. It's hard. It's been very difficult to have the uncertainty of closures and quarantines. But I have no doubt that my school has the best interest of my kids in mind, and that we will get back on track once once we have COVID in better control. Now is not the time to make drastic changes in our funding structure and formula. Now is the time for us to figure out how to support kids more, support our teachers more, and support those who are their administrators making things happen. So that's where I stand. I hope to hear from you. Glad to hear from you anytime. Email me, send me messages, comment on here. I'll watch this for questions or comments later. But you're always welcome to call the office as well. Thanks much. Have a good Friday.